A fracture is a break in a bone. Fractures are named according to their severity, the shape or position of the fracture, or even the physician or the doctor who first described them. So looking at common types of fractures, an open or a compound fracture is when the broken ends of the bone protrude or stick through the skin. Conversely, a closed or a simple fracture does not break the skin. In a comminuted fracture, the bone is splintered, crushed, or broken into multiple pieces at the site of the fracture, and the smaller bone fragments will lie between the two large pieces of bone. A green stick fracture is a partial fracture in which one side of the bone is broken while the other side just bends. It's similar to the way a young or a green twig or a stick will break on one side while the other side stays whole. Green stick fractures occur only in children whose bones are not fully calcified. An impacted fracture is where one end of the fractured bone is forcefully driven into the interior of another. This type of fracture is common in a fall from a height or in a car accident. And lastly, an epiphyseal fracture is a fracture that involves the epiphyseal plate of an individual who is still growing. If a bone fracture damages the epiphyseal plate, the fractured bone may be shorter than normal once that individual reaches adulthood. This is because damage to the cartilage of the epiphyseal plate can affect the ability of the chondrocytes or the cartilage cells to undergo cell division, as well as cause the premature closure of that epiphyseal plate. Moving on to the process of fracture repair, and fracture repair involves 4 phases. The first phase is the reactive phase, in which blood vessels crossing the fracture line are broken. Blood leaks from the torn ends of the blood vessels, and a mass of blood forms around the fracture site. This mass of blood is called a fracture hematoma, and it usually forms 6 to 8 hours after the injury. Because the circulation of blood stops at the site where the fracture hematoma forms, the nearby bone cells will die. Swelling and inflammation will occur in response to the dead bone cells. And phagocytes and osteoclasts then begin to remove the dead or the damaged tissue around the hematoma in a stage that can last up to several weeks. The second phase is the reparative phase with the formation of a fibrocartilaginous callus. In this phase, blood vessels grow into the fracture hematoma and phagocytes continue to clean up the dead bone cells. Fibroblasts from the periosteum invade the fracture site and produce collagen fibres. And in addition, cells from the periosteum will develop into chondroblasts and begin to produce fibrocartilage. These events lead to the formation of our fibrocartilaginous callus, which is just a mass of repair tissue consisting of collagen fibres and cartilage, and it bridges the 2 broken ends of the bone. The formation of the fibrocartilaginous callus usually takes about 3 weeks. The third phase is the reparative phase with the formation of a bony callus. Here, in the areas closest to the healthy bone tissue, osteoprogenitor cells will develop into osteoblasts, which begin to produce the spongy bone trabeculae. The trabeculae joins the pieces of bone, and in time, the fibrocartilage is converted from the cartilage to spongy bone, and the callus is now referred to as a bony callus. A bony callus usually lasts about 3 to 4 months. The final phase is the bone remodeling phase. In this phase, dead fragments of the original bone are gradually reabsorbed by the osteoclasts. Compact bone replaces spongy bone at the periphery or the outside of the fracture. And bone remodeling will occur to return the bone to its original shape. So those phrases in text for you. The reactive phase is the first phase, in which the blood vessels at the fracture site are broken, blood will leak out into the area, and a fracture hematoma will form about 6 to 8 hours after the injury. Due to the lack of blood, bone cells in the area will die, which triggers swelling and inflammation. Phagocytes and osteoclasts will come into the area to remove the dead and damaged tissue. In the reparative phase, with the formation of the fibrocartilaginous callus, blood vessels grow into the hematoma. Fibroblasts and chondroblasts invade the fracture site, producing collagen fibres and fibrocartilage. This fibrocartilage callus will bridge the two ends, or more than two ends, of the broken bone. In the reparative phase, with the formation of a bony callus, osteoblasts begin to produce trabeculae, which forms spongy bone. That fibrocartilage is converted to spongy bone, forming our bony callus. And lastly, our bone remodeling phase, where the compact bone replaces spongy bone around the periphery or the outside of the fracture. Osteoclasts and osteoblasts will undertake bone remodeling and return that bone to the original shape, almost to the extent that you would never know that it was fractured.